Good afternoon, and welcome to the Johns Hopkins 30-minute COVID-19 briefing, where we provide live insights from the experts who lead our work at the Johns Hopkins Coronavirus Resource Center. For the next half hour, we'll focus on what you need to know right now about the COVID-19 pandemic and public health responses. As part of this briefing, we'll have an opportunity for live Q&A with our experts, and we'll be offering these 30-minute briefings on Fridays at 12 p.m. During the summer, these briefings will be every other Friday. I'm Dr. Lainie Rutkow, a professor at the Johns Hopkins Bloomberg School of Public Health, and I'm part of the leadership team for the Johns Hopkins Coronavirus Resource Center. We'll be providing answers in real time today, so please submit your questions in the box at the bottom of your screen. Before I turn to our experts, I wanted to tell you about an event that we'll be hosting next Friday, July 16th. It's the first expert forum from our Pandemic Data Initiative. We're going to have a panel discussion and live Q&A focused on the challenges and opportunities that public officials have faced when managing COVID-19 data. You can register for the forum by clicking on the banner that you'll see on your screen during today's briefing. And again, that forum will be next Friday, July 16th at 12 p.m. Today, I'm joined by three guests. First, Beth Blauer, who is Associate Vice Provost for Public Sector Innovation at Johns Hopkins University. Beth is going to give us an update about the Pandemic Data Initiative. Next, Dr. Jennifer Nuzzo is a senior scholar at the Johns Hopkins Center for Health Security and an associate professor at the Johns Hopkins Bloomberg School of Public Health. Jennifer will give an update about trends we're seeing in the COVID-19 data. And finally, Dr. Bill Moss is executive director of the Johns Hopkins International Vaccine Access Center and a professor at the Johns Hopkins Bloomberg School of Public Health. Bill will give an update about COVID-19 vaccines. I'm now going to turn to each of our speakers for a brief overview. Beth, first to you. We're starting to see changes in how often states are reporting data about the pandemic. Do you see that as a cause for concern?
Thank you, Lainie. Yes, absolutely. We've seen a very troubling trend in the last several months of states that were reducing their public reporting of COVID data. If you're following the Pandemic Data Initiative closely, which I encourage everyone to do, I've written about it extensively and have been tracking it on a state-by-state basis of which states are contributing data and at what levels. We had a number of states reduce weekend reporting, which has happened for the last 6 months. And in the most recent months, we've seen some states constricting their reporting to maybe 1 or 2 days a week. The real challenge also is that we had our very first state, the state of Nebraska, that has now decided to wind down all tracking efforts and be deferential completely to the CDC reporting. Why is this a concern? It's a concern because the CDC has federal frameworks that restrict the way that they can share data, which means that the timeliness of the data that we've been receiving and these state and local reports of the data have given us a granularity that the CDC cannot achieve in the same way. So you'll see differences between what the CDC reports and what had been historically reported from our state and local sources. This also starts to really hamstring our granularity, our ability to see details at the very local level. The data is not going to be as accessible in the county levels, giving us that very local view of how the disease is progressing. And this is problematic because we know that our personal decision making, all the policy making that has been so critical throughout the arc of the pandemic is really driven by these really local granular views of data and information. And without those views, we have an inability to understand how we should be behaving and responding to the effects of the disease itself. So absolutely an area of concern, something we're going to continue to track in the PDI. Look for next week an update to some of our current thinking around why it's so important for states to continue this. And I will put another plug in for our PDI forum, which is taking place next Friday, where we're going to have a panel of people who have deep experience in the sort of applied way that data has been shaping public policy. So we'll have the Baltimore City Health Commissioner, Dr. Dreiza. We're going to have Amanda Doflos, who's been leading the charge, who had been leading the charge in the city of Los Angeles around COVID response. And then Dr. Josh Sharfstein, who's been a very vocal leader in this intersection of public policy and data throughout the arc of the pandemic, and I will round out that panel. It's going to be an exciting conversation, and it's really going to be focused on this kind of key tool that we've had in pandemic response, which has been policy, and policy that's driven by data that's been collected at the state and local level. So thank you. Definitely an area of concern, but I'll turn it back over to you, Lainie.
Thanks so much, Beth. Really looking forward to next week's forum. And I know you have to jump, but it's always great to have you as part of this briefing.
Yeah, thanks for having me.
Jennifer, I'm going to turn to you now. So it seems like there's this feeling of optimism in the US, at least in many parts of the US as we head through the summer, but around the world, we're seeing increasing case numbers, often due to the Delta variant. So given this global situation, are we having a false sense of security in the United States?
Sure, thank you, Lainie. First of all, I mean, I think the United States has been fortunate in the past few months to be coming out of what had been one of the worst phases of the pandemic for the US. So several months of sustained case declines, I think, was a very welcome development. Unfortunately, trends are starting to head in the wrong direction. And this week is now the second week that the overall number of cases reported in the United States has increased. We are seeing an increase not only in case numbers nationally, but also test positivity, which is an indication that there are also more infections likely occurring, and that we need to start thinking about testing more to find the infections that we're missing. In total, we saw 24% more cases reported this week as compared to last week. In about 38 states, case numbers are higher this week than last week, and about nearly half of US states have reported at least a second week of case increases. I always like to look at 2 or more weeks to see if we're headed in if this is actually a trend. And unfortunately, about almost half of US states are showing a trend of increasing cases. This, of course, is a really concerning development. We are also, unfortunately, now starting to see hospitalizations increase. And so there are about 15 states are reporting an increase of 5% or more in their hospitalizations. We found about 9 states where cases are increasing as well as hospitalizations, and I expect that the other states that are starting to report an increase in case numbers will, in the weeks to come, also see an increase in hospitalizations. Over the July 4th weekend, there were really disturbing stories coming out of Missouri, which has for now several weeks been reporting worrisome case increases and increase in hospitalizations, reports of shortages, local shortages of ventilators and other things. So unfortunately, the health systems in different parts of the state, are experiencing stresses as a result of sustained increases in cases and hospitalizations. So I think this is quite a worrisome trend. We have been looking at where these increases are occurring, and we have generally found that they're largely the sort of the South and the Midwest, largely states with lower than the national average vaccination coverage. That said, if we only look at the state level, that's going to, I think, hide some of the problems that exist elsewhere in the country. So we began looking at the case increases at the county level and found about 150 counties throughout the country that have been seeing case increases for several weeks now. About 2/3 of these counties are in states with lower than the national average vaccination coverage, but 1/3 aren't. And I think what we need to take away from this is that local trends are going to matter. Having the granular data that Beth Lauer talked about is really essential, because even if you live in a high vaccination coverage state or a state that is not experiencing at the state level case increases, the county that you live in, the local environment where you live in, may have a completely different epidemiologic trend. And so this is why it's really important to have local, highly granular data, particularly as our case numbers get smaller. We need a finer tooth comb to find the problems and to try to act on them before they become bigger problems. That's the goal now, is to make sure that we act as quickly as possible. And it's really essential that we continue to work to increase vaccinations. Some of the counties where we're seeing the biggest case increases have some of the lowest vaccination rates in the country, 16, 15, 20% coverage. That's really quite unfortunate, and we have to do more to improve coverage in those areas. Globally, the picture is, of course, even more dire. This week, we unfortunately passed a very grim milestone of reaching 4 million deaths reported worldwide from COVID-19. Most of these deaths, more than half of these deaths, occurred in 2021. I can't stress how utterly tragic that is. The fact that we have lost this many human lives, but particularly we have lost more human lives since the advent of vaccines. This is because we have not done a good enough job at making sure all places have access to vaccines. And unfortunately, parts of the world where access is low, we are seeing really deadly case spread occurring. This week, we can, of course, continue to be worried about Latin America, which for many weeks is seeing very large case surges, but now there are other parts of the world where the case numbers are climbing in really worrisome ways. Eastern Europe, Asia, several countries in the African continent. We also have to recognize that the ability to test and identify cases is not as well distributed either. And so the official numbers may not reflect even close to what the tolls are happening in each country. And I've said before, when I start seeing countries that had been previously quite good at being able to contain the spread of COVID through the traditional public health measures, now having very worrisome case surges, largely probably due to the spread of more transmissible variants, it really underscores the urgency to make sure we improve access to vaccines, because that's really the tool, the path that's going to pave the pathway back to normalcy, not just for those countries, but for all of us. If we want to stop hearing about a variant of the week and be concerned about whether new variants are going to be effective, respond to the vaccines that we have, we need to do more work to make sure that all countries have access to vaccines.
Thanks, Jennifer. It's a sobering but really important update. Before I turn to Bill, I want to remind those who are watching, please submit your questions for our experts in the box at the bottom of your screen. Bill, I feel like I keep talking with you about how only around half of the US population has been vaccinated, and unfortunately that continues to be the case. Yet we have a surplus of vaccine in the US and other countries are in desperate need of it. So within this context, what do you see as the key developments in the vaccine rollout during the last few weeks?
Yes, you're exactly right, Lainie. We have hit kind of a wall in the United States, and as Jennifer just outlined, we're seeing tremendous surges in many parts of the world where vaccines are not yet available. So here in the United States, the pace of vaccination has really slowed. The 7-day average of the number of doses of vaccines has fallen below 500,000. That's from a peak of over 3 million vaccinations a day in early April. And as a consequence, the proportion of the US population who's received a single dose or is fully immunized remains low and is just not increasing at the rate we would like to see it. So if we look at the total US population, only about 48% of Americans are fully vaccinated. If we look at those older than 12 years of age, which is the age group eligible for vaccination, we're at 56%. So nowhere near where we need to be. We're still not at President Biden's goal of 70% of adults over 18 having received a single dose. We're at about 67%. And as I said, that rate of increase has really slowed. One thing that is remarkable, it is a positive story, is that more than 88% of adults older than 65 years of age have received at least one dose of a COVID-19 vaccine. That's where we need to be with the entire country across all age groups, at least all age groups eligible, older than 12. But it is quite remarkable that older adults in the United States have very high coverage right now. I wish we had kind of hit this wall where we were at about 70 or 75% at least of Americans vaccinated. So we've hit this wall at a much lower percentage of Americans vaccinated than I had hoped. And this comes down, as we've talked about before, Lainie, this combination of access and demand. And great progress has been made here in the United States in increasing access to vaccines. We need to do everything we can to improve access. This is a problem that I've seen, with vaccines in general. There's always a hard to reach population. Usually it's smaller than 50%, but there needs to be strategies, and the Biden administration is promoting, door-to-door vaccinations, mobile clinics, workplace vaccination sites, getting vaccines to healthcare providers so that they can be the ones at the front line administering vaccines to young adults who are going back to school. But all that is very important, but it has its limitations if there's not the demand. And here we're really facing, a classic kind of tension between public health and kind of individual freedoms. I initially thought of this as kind of, the strategies to address the problems with demand as both kind of the carrot and the stick. The carrots can be all these incentives that we've talked about, the lotteries, the sports tickets, the free beer, and then combined with kind of pleading and requests. We've seen President Biden, just asking the U.S. citizens to be vaccinated. But there's also been a lot of discussion recently and ongoing about other mechanisms to increase coverage with COVID-19 vaccines, which, as Jennifer said, is really the only way we're going to get behind or beyond this pandemic. So a lot of talk about mandates and passports, but perhaps a better way to think about it rather than the stick is really just a collective responsibility, which we seem to have lost, that there's a public health responsibility for all individuals to not only protect themselves, but to protect those around them and those in their communities. I don't foresee, federal mandates, but we're seeing, increasing mandates from employers, from schools, from the private sector, such as we have at Johns Hopkins University, as a way to really make being vaccinated the norm and make it more difficult for people to really opt out. So I want to emphasize that we really need to get to a place where it's harder to refuse vaccination, and where being vaccinated is really the default. Now, a lot of this is, as we were talking about, being driven by these, or the importance of this, the importance of getting higher vaccination coverage is really highlighted by these more transmissible variants, particularly the Delta variant that Jennifer referred to. And there are a number of different vaccination strategies to deal with these more transmissible variants, such as the Delta variant. The first, and by far the most important, is just is to increase vaccine coverage and have more people fully immunized. But there's been a lot of talk recently, even just in the past few days, about booster doses of current vaccines. So those will increase the antibody levels and provide protection against the variants. Or also modified vaccines that are really targeted toward the Delta variant. Right now, there's no need or recommendations for booster doses for people who are fully immunized in the United States. And this will be a decision by the FDA, the Food and Drug Administration, and the Centers for Disease Control and Prevention with input from the Advisory Committee on Immunization Practices. These are the expert groups that will make the decision on when and for whom booster doses are needed. And I think the bottom line for people to take away is that the currently authorized vaccines in the United States remain highly protective against severe disease due to all of the known the variants, and particularly the Delta variant. Now, we have been hearing, particularly from Pfizer, the recommendation or advice that we may need booster doses, and what they're drawing this conclusion in part on some recent data that was presented by Israel's Ministry of Health, saying that the Pfizer vaccine, that they're seeing the efficacy or effectiveness decline from about 90% to 64%. It's unclear, how generalizable that is. There are other studies suggesting that the protective effectiveness remains high, maybe a little bit lower than what was seen in the phase 3 trials against earlier variants, but certainly it remains high against severe disease. Where there's also been reports of laboratory studies looking at neutralization of the Delta variant. Some suggesting very high neutralizing activity, like with the Johnson and Johnson. There was recently a study from France suggesting that the still protective neutralizing antibodies, but at lower levels than against the Alpha variant. So I think the bottom line for me here is that 2 doses of an mRNA vaccine remain highly protective against the Delta variant for the severe outcomes. There may be some lower or reduced effectiveness against mildly or asymptomatic infection, and we're just going to need to continue to monitor this. Now, Pfizer did say that they have evidence that a 3rd dose of the Pfizer vaccine really boosts antibody responses, and that they'll be seeking emergency use authorization, and that they are working on it. I know Moderna is too, about vaccines that specifically target the Delta variant, but we're not yet at a place where we need to invoke those strategies. We need to focus on increasing coverage in the United States. And I'll just end, Lainie, I agree completely with Jennifer about the tragedy that's happening across the world. I'll just highlight, this was the worst pandemic week ever in Africa, according to Dr. Moetti, the WHO regional director for Africa. I had an opportunity to speak with her before the pandemic, and she was very optimistic about health and the health systems in the continent, but we're seeing them being really overwhelmed by this pandemic now. And I'll just end by saying that only just over 50 million doses have been administered to the people of Africa. Only about 1% of Africa's population is fully vaccinated, and we really need to address this global problem.
Thanks, Bill. Those are some devastating numbers that you just shared. Before I move to Q&A, I want to remind those who are watching that we do have a weekly newsletter available from the CRC called The Week in COVID-19. You can click on the banner that you see on your screen during this briefing to subscribe to it. And now I'm going to turn to questions that have been submitted for our experts. Jennifer, first question is for you. As we see these case numbers increasing, do you have a sense of the age groups that are most affected? So is it children, teenagers, young adults, or does this hold true across all age groups?
Yeah, so not fully. I expect that it's what the traditional epidemiology has been is that we usually see the cases rise in the young sort of working population, and then it does follow to other age groups that are not protected from vaccines. So I expect that we will see a rise among all age groups. But so far, no evidence to suggest that children are disproportionately affected. As the numbers go up, their share of the numbers will, their total numbers will go up as well.
Thanks, Jennifer. And one more question for you about genomic sequencing, which is something you've talked about previously on these briefings. Can you give a quick status update on where things stand with sequencing for COVID in the US?
Yeah, so there have been a few developments. First of all, the amount of sequencing that the United States is doing, the percentage of its cases that are being sequenced has increased, and that's really useful. There are some challenges, though, with the timeliness of the data that's being shared and also the representativeness of the data. And I will say that the statistic that you most frequently hear is what percentage of cases are a variant or not. That tells us perhaps the relative dominance of the variants, but it's not really enough to say that what the overall prevalence of that variant is, in part because the cases that are sent for sequencing may not fully be reflective of the overall population. Some jurisdictions are sampling and deciding which cases to sequence with that goal in mind of trying to get a better estimate of what the prevalence of the variants are. So of all the people that are infected, what percentage of them are, say, the Delta variant. But usually what happens is there's some other selection criteria in some places, maybe an unusual cluster of cases. Those cases are sent for testing, and then you find out what percentage of those are the variants. So it's a little bit hard to interpret from a broader sense. That said, there's quite fairly good evidence now that the Delta variant is going to be the dominant variant for some time. We seem to see this pattern. A new variant comes in, it probably has some advantages and takes over. We may yet see another variant at some point in the future. I hope not, if we do a better job of sharing vaccines. But one other issue that I just want to flag, and this goes back to some of the points that Beth made in the beginning, which is some of the timeliness of the data. So there seems to be a several week lag in terms of the sharing of sequence data. Some of this is because jurisdictions do actually wait to sequence their cases, because the way that it's done in a laboratory, it's easier to run in a batch, and so they wait till they get a certain number of specimens, and then they'll sequence it. But also, I think there are some reporting and data sharing delays. So it's still not really possible to get an up-to-date, very timely estimate of the spread of these variants.
Thanks, Jennifer. Bill, a question for you. So we now have 3 vaccines in the US that are under EUA, emergency use authorization status. Any sense of when one or more of those vaccines is likely to receive full FDA approval?
Yes, it's an important question. It's not entirely clear right now when that full approval will be. That approval process is a much longer process than the process that for an emergency use authorization. It requires more data be presented. So I would think in perhaps the next 2 months or so that we may see that, but I don't have a precise estimate on that timeline.
Thanks, Bill. And I'm going to give you the last word with just a quick question. Are the vaccine manufacturers currently doing trials on boosters?
Yes. So there are a number of different trials ongoing with booster doses, and we're beginning to even see some of the results of that. But just as one example, the NIH is running a trial with a booster dose of Moderna for people who received any of the 3 vaccines that have received emergency use authorization. And we're expecting in August that Pfizer will start another trial actually with a new vaccine, it's the same mRNA vaccine, but it targets the Delta variant.
Got it. Thanks so much, Bill. I'm going to start wrapping up then. I'd like to thank Beth Blower, Jennifer Nuzzo, and Bill Moss for joining me today, and give a big thank you to everyone who joined us, and especially to those who submitted questions for our experts to answer. This briefing will be archived and available on coronavirus.jhu.edu. As a reminder, we offer these 30-minute briefings regularly on Fridays at 12 p.m. And this summer, we're offering the briefings every other Friday. So that means that our next briefing will be on Friday, July 23rd at 12 p.m. As always, in each briefing, we'll focus on what you need to know right now about the COVID-19 pandemic, and we'll have live Q&A with our experts. I want to remind you about what Beth Blower mentioned at the beginning of this briefing, which is that we'll have our first expert forum from the Pandemic Data Initiative next Friday, July 16th at 12 p.m. This will be a great way to learn about challenges and opportunities that public officials have faced when managing COVID-19 data. I'll look forward to seeing you at our next 30-minute briefing. Until then, thanks and stay safe.